Hello, my name is John Tricu. I'm the radiologist here at Iroquois Memorial Hospital in Watseka, Illinois. And I've been asked to talk about Thrombosis Day, which is coming up on this Sunday, October 13th. This is really a day for awareness because of a very preventable condition called deep vein thrombosis. Almost everybody has had a scratch or a cut on their hand or something where they see the blood well up and then form a scab. That is the clotting process, but it can also happen on the inside of the body. And when it happens in the veins, particularly the leg veins or the arm veins or the pelvic veins, they can be significantly larger clots, and we call that deep vein thrombosis. The problem with deep vein thrombosis is that when it happens, those big clots can break off and flow to the lungs and cause a life-threatening condition called venous thromboembolism, also known as pulmonary embolism. Those clots can block the arteries to the lungs, which prevents oxygen from exchanging, and patients will present with chest pain or coughing up blood or shortness of breath. Sometimes they'll also get some sweating or headaches, dizziness, confusion, but most concerning is that it can actually be large enough blood clots that it causes a person to get killed and die. The Center for Disease Control has estimated that between 50,000 and 100,000 Americans will die of blood clots every year. So it's a very easy to imagine that it's a very important disease. Patients who do get blood clots will end up with swelling of the legs or numbness in the legs and change in the color of the skin and pain. And those are very concerning conditions. So if you ever do get those symptoms, you should seek medical attention right away. Causes for blood clots basically have to do with immobility for the most part. So patients who've had surgery who are not moving around, or people who've traveled long distances, particularly in a vehicle or an airplane and not getting up and moving around periodically, are at risk of getting blood clots. It's also common in patients who are pregnant or obese, who have alcoholism problems or cigarette smoking, and there's also believed to be a relationship associated with contraceptive use of contraceptives. So it's a very preventable condition that we can be able to intervene on. So that's my discussion about venous thrombosis and pulmonary venous embolism. If you want more information, I found a nice website on the line called worldthrombosisday.org. Thank you.